During your radiotherapy treatment, there are nurses in the department or treatment review radiographers. We will see you towards the end of treatment to discuss side effects and what happens next. Skin in the treatment area may become more red. The skin can get dry, can get itchy. The skin can break, split, peel or blister after treatment's finished. People often find that they do get tired during treatment, so you may experience that you do get very tired during treatment and for a good couple of weeks after treatment. Sometimes this can go on for many months after treatment. It varies from person to person. It's good to drink plenty of fluids, to eat a sensible diet because they all help with the feelings of fatigue and energy levels. It's good to exercise or have some activity because research shows that activity such as walking can make the feelings of fatigue or tiredness better. Your breast can feel uncomfortable when you're going through treatment as it can become inflamed and irritated by the treatment, and so we recommend that you take painkillers if you need to, and you can wear a soft supportive bra.
The side effects of radiotherapy are very much like sunburn, but without the lovely holiday. So you moisturise daily. I moisturise twice a day, and you make sure that you've kind of rubbed all the moisturiser in each time as well. That will just help to prevent the burning that occurs as part of the process. It's literally just where the radiotherapy has zapped, and it was literally the size of my collarbone. So it wasn't very big at all really. And to be honest, I noticed it more than anyone else did. In terms of other side effects, yes, there's that element of tiredness, but again, I believe that's more because you're coming and doing this every single day, so it's becoming something you've got to sort of slot into your life. And it's a fatigue tiredness, but it's nothing that a sleep or an early night can't get rid of. The one thing that I did find is that towards the end of the 4 weeks, I preferred to not wear my bra because I was aware that it was going to aggravate the skin a little bit more. So if you can perhaps factor that in, and it also made it easier getting on and off the undressing for the radiotherapy as well. So yeah, I ditched the bra for about 2 weeks.
You may experience some sharp shooting pains within your breast. This is usually due to where the surgeons have cut through the nerves, and it takes time for the nerves to reconnect and heal, so it's all part of the healing process. It's not the radiotherapy doing any harm to your breast tissue, it is the normal healing process from the surgery.
You can experience some niggles and the odd occasional twinge. For me personally, I thought that meant that the treatment was doing what it needed to do. So it was necessary, it was vital, and it certainly wasn't anything that would cause you to not do anything. And I believe you could take paracetamol throughout radiotherapy if you need to as well. So yeah, it was all manageable completely.
The real concern for me as an oncologist and for my patients is, will this treatment have caused long-term harm? Doing the treatment in the way we do with multiple small treatments over a few weeks is a way that we are very confident keeps the risk of long-term harm to a minimum. And in any situation where I'm recommending treatment to somebody, I'm thinking about, for you, what's the risk from the cancer you've had now and over the next few years, and trying to make sure I treat you as best I can whilst keeping the risk of any problems 10, 20 years hence as low as possible.
The long-term side effects are uncommon, but unfortunately, if you get a long-term side effect, it could be with you for the rest of your life, which is why it's really important to know all about it. Some of the most common of those side effects are a change in the shape or feeling of the breast. So the breast may be a little bit bigger or a bit smaller, may feel a bit firmer than before. And there can also be some skin changes. So sometimes the skin will look a bit darker or a bit lighter. It's also possible to get some lung changes because the lung sits right behind the breast, and so a little bit of it is going to catch the radiotherapy. So some women, just a few, will in the future have a bit of shortness of breath or maybe a dry cough following the radiotherapy. For the left-sided treatments, that the heart may get a bit of the radiation dose, which means that the risk of heart problems in the future may be slightly higher.
The breast discoloured a couple of weeks after radiotherapy, and it looked slightly different to the other one. But now I'm 3-4 months on, and everything's pretty much back to how it was before the treatment started.
There can be some tightening of the muscles over the chest wall, which means that the overall range of movements at the shoulder may be a little bit more restricted. It can range between 5 to about 20 per 100 patients, but it really depends on the extent of radiotherapy that you've had, whether you've had the lymph node areas treated or just the breast.
The exercises that you're given to do post-surgery are extremely important. No matter how tired you feel, I thoroughly recommend that you get up and you do them, and then you can monitor your progress. I personally don't have any difference at all in my arm movements, not even a few centimetres. I can reach the same on both sides because I was quite vigilant with the exercises.
The only serious long-term complications are related to the risk of cancer developing as a result of the radiotherapy itself. This is a small risk. It's about 1 person for every 100 over the course of a lifetime.
Radiotherapy can be a difficult time emotionally for you. It comes at the end of months of treatments and you're often going through the side effects still. And it can be a time when you look back on all that's happened and think about what's going to come next. So we can offer support for you during radiotherapy with time to talk about thoughts and feelings. And it's often a conversation that is enough to help work through those worries and concerns. And we can offer suggestions for practical solutions or lifestyle changes that can help. We can also suggest that you visit Maggie's to get further advice and support. It's a place to meet other people that are going through similar things. They have classes which can help people, such as relaxation and visualization. If needed, there is a counselling service offered at Maggie's, and there's also one within the oncology service as well. And they can provide you with that specific support that you might need. We have contact details for many support groups in the region that we can give to you as you need them.
The staff here are fantastic, and every day they will ask you how you're feeling and really ask you how you're feeling rather than just, hi, how are you? So if you've got any worries or any concerns, no matter how big or small, then you know that you can voice them at any point through the daily process. All the way along you are led by the hand if you need it. Do you think that the last day you're going to be running out and skipping down the corridor? But actually there's more of a sense of peace at the end of it, and now what happens to me? You know, where do I go from here? So I think that radiotherapy doesn't just mark the end of the treatment, it marks the beginning of you kind of coming to terms with what's happened.